The agenda is presented. Judy
Judy.
and Joe. Oppose? None. Any conflict of interest on the agenda as presented to you today? Hearing none, we'll move on. And we'll have an update from Dr. Ahmed on 4.1. That's our COVID-19 update. Oh, before I have Dr. Ahmed come in, I see Felicia's here too, so I want to take this opportunity to congratulate Felicia and as moving forward. So that's terrific, and we wish you all the best as with the board, and we're looking to continue to build our relationship with the board and certainly the senior management team. So once again, Felicia, congratulations.
Thank you, Mr. Chair.
Okay, Dr. Ahmed.
Thank you, Gary. I will put my slide deck up. Okay, so I'm just using the slide deck just to guide our discussion in terms of where we are with respect to COVID-19 cases and everything that's been happening in the region. I'll start off first with the cases and some of the updates related to the COVID-19 transmission in our community. So what we are looking for this slide is basically just giving you a comparison of where Windsor-Essex is in and where the province is heading with respect to the COVID-19 cases. And in this graph, we can easily see that the cases are declining in the province and also in our region. And obviously our region is in a much better spot compared to the province in terms of these cases. Translating all these cases and decline into week by week incidence rate per 100,000 population. And what we can see is since from the beginning, we saw a huge increase in the third wave, or sorry, in the second wave in December, January timeline, and then we saw a mini a third wave in our region, and then since then the cases continue to decline overall. So just looking at our past 7 days or the completed case rates, right now it stands at 14.8 cases per 100,000 population, which is another decrease from the last week. So those are the completed week. But if we just look at the last 7 days, our case rate is 13.2 cases per 100,000 population. This is another decrease from last week. So really, as a region, we are doing much better with respect to our cases, and cases continue to show on the downward trajectory. And a lot of that is obviously resulted from our high vaccination rate in our community. On the same lines, looking at the percent positivity of all these cases, and as we can see that the percent positivity is also declining in our region. And in total, we have tested more than 360,000 tests since the beginning of the pandemic up until June 12th. And obviously, this is based on the complete week, which ended on Saturday. But for the week ending on June 12th, our percent positivity was at 2%. And again, this has been a decrease from last week, and last week it was close to 3%. So another decrease in the right direction. Comparing ourselves with our case rates, no surprises there. We continue to have the fourth highest case rates, and this is throughout the pandemic overall cases. And a lot of those cases, as we know, were from the first and the second wave. Third wave, we did very well compared to many of the regions. What we are breaking it down further in terms of our municipality and our cases, all these cases are looking in the city of Windsor. As I mentioned, seeing some cases, not to any larger extent, and it fluctuates between one municipality versus the other. From an age and sex distribution, majority of the cases that we are seeing is in the younger population, which we can see that probably it is happening because of our higher vaccination rate in the older age group, and the younger population with these cases are not even vaccinated at this time. We started vaccination of our younger population just recently, and we continue to increase that. Leanne, can you hear me properly, or you're having some problem hearing me?
You were freezing a little bit, Dr. Ahmed.
Oh,
We can hear you a little bit better now.
Yeah.
okay. So please let me know. Okay, all right. So so hoping that with the high vaccination rate in the younger population, the distribution of cases will be similar to what we have seen throughout the pandemic. From the exposure perspective, we are seeing a good blend of close contact, household contact, as well as the community transmission. So it's not different, but just the magnitude is getting lower and lower. So this breaks it down in terms of the percentages. So roughly around 38% of these cases are from close contact, household contact, and then 36% coming from the community. Overall, from a hospitalization perspective, it's going down in the province and in our region. Similarly, cases in the ICU are going down in both the province as well as in our region. Our case doubling time continues to increase, which is a good sign. So anytime this particular graph, if it's going high, that means we're doing better. So overall, Canada, province, and our region, they're all moving in the right direction, and our case doubling time much more pronounced than Canada and the province of Ontario. From a median R effective, which is the reproductive rate, which means how quickly each of these cases are generating new cases, and our most recent estimated median R naught is 0.7, which basically means that the infection in our community has been going down overall. We reported this morning 72 active cases only in our region, which is again showing the benefit of vaccine as well as the good work that everyone is doing. So now switching gears with respect to the vaccination, just as a quick highlight in terms of how the entire world is doing with respect to the COVID-19 vaccine and share of people who have received at least one dose of COVID-19 vaccine. And in this graph, we can see that Canada has basically surpassed all of the other countries of the world in giving out the most first doses of COVID-19 vaccine and is in a good trajectory to do the same for our second dose as well. And then translating it locally in terms of these vaccine doses that are administered to Windsor-Essex resident, it continues to increase as every day. Some days it's touching close to 7,000, and in the past 7 days, from a proportion perspective, more than 90% of our doses that was given out were second doses. So our first doses, new first doses are declining, and majority of these doses that we are administering at our mass vaccination clinic are the second doses. So just looking at from a data perspective, obviously we hit 7,000 mark at some instance, which is really a big achievement. But on an average, we are administering 5,400 doses, slightly over 5,400 doses daily in Windsor-Essex. Again, given the size of our community and the number of doses that are given out, this is pretty significant. From a cumulative doses perspective, this particular graph basically is just giving you that now we are plateauing with respect to our first doses, but the second doses we just started to increase, and it will continue to increase as we move forward with giving out second doses. So this breaks it down, all these doses that are given out with by age, and overall it's 60.9% of our residents that have received at least one dose, and that includes even infants or younger children who are not even eligible to receive the vaccine. Among those who are eligible to receive the vaccine, which is 12 plus, our coverage rate is 70.5%. And from a data comparison perspective with other countries, most of these countries are using 18 plus as a cutoff. So from that perspective, we are at 72.9% of our coverage rate. And then throughout the age band, we can see that there's a gradient effect with more higher coverage in the older population and gradually slows down to the younger population with respect to the coverage rate. So this particular graph basically gives us a sense of what is happening with respect to the new vaccine uptake. And basically, what you're looking is the plateauing effect more pronounced with each of these age bands. And the earlier age group or the older cohorts, they receive their vaccine and their very limited uptake in the new first doses. But in some areas, definitely there's room for improvement. Anyone, especially between the ages of 30 to 39 and 40 to 49, the age group can definitely improve their coverage rate. So this is a graph basically that shows not just the first dose, but it also includes anyone who has received the full 2 doses of COVID-19 vaccine in the region. So overall, again, from including anyone and everyone, including children, young children who are not even eligible, we are at close to 22%. But anyone who is 18 years and older, we are at 27.4% coverage for fully vaccinated people. And again, a gradient effect with respect to the age group that we are seeing. Similar graph, basically just showing the plateauing effect of the people who are covered. So a huge uptake in the 80 plus and then gradually declining, followed by the green line, which is the 70 to 79 continue to be on the rise, and then 60 to 69 continue to be on the rise, followed by the rest of the age bands. From a hotspot coverage perspective, as I mentioned, overall our coverage is 60.9%. And our hotspot coverage at 55.5%, so slightly less than what our overall vaccine coverage looks like in the region. While some of the hotspot areas have a higher than overall coverage rate for in our community, and some areas such as N9A and N8X. N9C, those are the areas, even N9, N8H, those are the areas that we are seeing slightly lower uptake of vaccine, highlighting the importance of doing more work in these neighborhoods. So similar data just for the second dose, similar picture, 21.8 or 22% overall coverage for our oral community and 18% for our hotspot community. And again, some of these effects are more pronounced in one or the other hotspot areas. With respect to the location of doses administered to Windsor-Essex residents, majority of the vaccine continue to be administered by our hospital-based clinic. Given that they are in operation since December, while the public health clinic that started operation in March and around that timeline continues to give out the vaccine, and then followed by a pharmacy chain, which really helped us to distribute a lot of the vaccine for us, and then our primary care, long-term care home, and then including others are the mobile clinic and some of the targeted clinic we did for these for the vaccines. So overall, 70% of our vaccine that were given out in our region is Pfizer BioNTech, followed by 15% Moderna and AstraZeneca. And this graph basically just tries to integrate all of these efforts from vaccination cases and then the first dose vaccine versus second dose. So what you're looking here is in the dark shade or the dark blue shaded area, which is basically giving you the daily case counts in throughout the second wave and then followed by the third wave. And the green line that you're looking at is basically just giving you the vaccine coverage rate with the first dose only. And then the yellow line is basically showing you the vaccine coverage rate for the second doses. And as you can see that more and more vaccines that were given out, it really helped to decrease the cases in our community, clearly showing the benefit of vaccination, early vaccination, and the success of vaccination in our community. So in summary, the case rate continues to decline in our community, and our community is a much better position to even consider some of the relaxing some of these restrictions. COVID-19 hospitalization and ICU have continued to decline locally and in the province. Delta variant continues to be a concern in some of the regions of the province, not necessarily in Windsor-Essex at this time. Our wastewater surveillance data hasn't, I didn't put a graph for that one, but it continues to decline in the past week, and our overall vaccination rate is obviously is increasing gradually for the first dose now, but increasing rapidly for our second dose in our community. So in summary, for the monitoring indicators, based on the most recent completed week, 14.8 cases per 100,000 population. Most recent 7 days, it's 13.2. And our percent positivity has declined as well, 2.0. And then it basically fluctuates anywhere between 2 to 3%, which is better than where we were from the weeks before, and are not effective, continues to decline as well. Showing that the new cases are declining in our community. So I'll stop here now. Happy to take questions.
All right, I believe Reno has a question.
Yes, thank you, Gary, and thank you, Dr. Ahmed, for the update. Just a couple of things. One, if you can speak, I just want to give you an opportunity to speak about the issue about mixing vaccines, clarify some of the questions that were brought up in the community yesterday. And so just I ended up getting some comments myself, just because I think there was also a story about increased supply of Moderna coming in. And so people were asking if they have the Pfizer vaccine first, can and should they get the Moderna one. So I just wanted to give you an opportunity to please clarify that for us, for the community and everybody watching.
Mr. Chair, thank you for the question. Clearly, the evidence is behind the mixing of the vaccine, and there are some basic principles that we always rely on when we are considering mixing of the vaccine. Most importantly, the mechanism of action, the indication, the age group that it's recommended for, and the desired or intended effect of these vaccines. So based on all of those criteria, we know already that the mRNA vaccine is an mRNA vaccine. They act in exactly the same way. So we know about that. When it comes to the AstraZeneca to mRNA vaccine, there's really strong data from many countries, Germany, Spain, UK, that supports that mixing of the vaccine is beneficial, and it doesn't reduce the effectiveness or cause any safety concerns in any individual. Similarly, this mixing of these vaccines have been happening for much before we started, or we are contemplating starting the mixing of the vaccine. So all of this, we have data, we have lessons learned. It is not a new thing that we are doing. We have other vaccines that we mix and match quite frequently, because not every countries or every time you have the same brand of vaccine available. So vaccine interchangeability, again, it's not a new concept. It's been going on for some time. NACI, in fact, today clarified their position as well in terms of the interchangeability and mixing of the vaccine as well. So there shouldn't be any concerns in anyone's mind about any potential risks associated with the interchangeability of the vaccine. Both these vaccines are equally safe and equally effective to take in, and the recommendation has always been get the first vaccine that's available to you rather than waiting for that vaccine. And we know given the supply constraints, there may be opportunity for people to receive another type of mRNA vaccine, and they shouldn't have any concerns accepting that.
So today's, you alluded to the announcement today by Nancy. They came out saying that if you did receive the AstraZeneca, that it was, is it preferred to get an mRNA vaccine for the second dose?
Yeah, so they made a preferential recommendation, and again, sometimes it almost is in a way, and I tried to explain that the other day as well. What these vaccines are basically doing is they're trying to give your body some kind of an identifier to identify the virus, and so mRNA, the way it helps the body to identify the virus is slightly different than how the AstraZeneca or the viral vector-based protein a vaccine helps the body to identify the virus. So what the rationale behind their recommendation is, you're basically giving more opportunity for your body to recognize the virus in different ways, rather than saying that don't do it, you must stick to the same vaccine. And of course, there are some reasons to stay with the same vaccine when the supply and everything else is there. But we also know about some of the risk. And as more and more data comes in, we continue to look at the data, use the science to guide our decision making. But you're right. The mixing of these vaccines have been there, and the recommendations are there.
Great. And so, just pivoting to another question. So, a lot of the numbers seem extremely positive, and we're getting to some of the lowest rates in months and months. Looking at the provincial framework for reopening, and I know that there was phases set out. I think there was 3 phases total. They did schedule it with 3 weeks in between, but seeing the trajectory of the numbers and the direction that they're going, is there a possibility to move ahead to the next phase sooner? And if so, what would that look for? What would that look like, and what are we looking for at the numbers at that point for that to happen?
So I think from our numbers perspective, I think we meet the criteria that has been initially set by the province. Their criteria was to have even for a stage 2 or step 2, to have a vaccine coverage rate of at least 70% with first dose, and then 20% with the second dose. So we are already at close to 73% with first dose and 27% for the second dose. So we are way ahead of what the provincial criteria is. And from the indicators of the COVID transmission, that is also moving in the right direction in favor of us, with the ongoing and gradual decline of our cases in our community. And as I reported in the last 7 days, is 13.3 or 13 point something per 100,000 population, which is really good, and similar to what we have seen in the lowest timeline back in 2020, August, September timeline, when we had a low case count. So clearly we have come a long way, and thanks for the vaccination effort and our community's willingness to get the vaccine. And as soon as we continue to move forward in that direction, I think we do have an opportunity to meet that criteria. And if and when the province is willing to move us in a different direction, I'll be completely supportive of that, given what we are seeing in our community.
Do we have the opportunity or to make those decisions locally, similar to school closures or things like that, from the local WETU or medical officer health's recommendation?
Unfortunately, no, because these closures are under the order of the province and not under my order. It would have been much easier if it would have been just my order. And the province, what I heard, is looking for an early opening, but I don't have a timeline. But I think even if they have to do it, let's say this weekend, I think our numbers justify us to be there. And if and when province reach out to me, I think it would be, I'll be supportive of that.
Would it help or benefit from having a motion from the board to support that?
I don't know. I'll leave it up to Gary as the board chair to see if it's something. But from my channel, obviously, I can express my interest in the region moving forward. Not sure how it will work from through the political channel or where it has to go.
I'll have an motion at the appropriate time. Thank you.
Just before I go to Judy, I just want, just so that was my train of thought too. To your point, Reno, I can tell you that the county council did send a letter to the premier, basically telling them that we've not only have we met, we beat the challenges and in the numbers, and that to be cognizant of the fact that we were held back last year, and as you know. And so we've learned from that, and through the work of the good work from the health unit, and for our residents, so for being diligent as well. We should be recognized for that. So at the proper time, I think it's proper for us. I think at the end of the day, we take our advice from the medical officer of health and so forth. So I think it's would be appropriate. The other piece where I just want to add that Dr. Wajid had mentioned to you about the mixing of the vaccines and so forth. When he had mentioned about the two different types, like the AZ and the Pfizer, will build even stronger immunities. That's exactly what happened. I got the AZ first, and then my second dose is the Pfizer. And under the advice of the pharmacist that dealt with, it's almost verbatim. I don't know, Dr. Ahmed, if you had a phone call with him, but it's verbatim what he said. And so my wife and I were very pleased that we got our second shot. It was available, and his comments is that from what they're hearing from Germany and UK and Spain and others, is that your body's adjusting to two mechanisms that are preparing it for the onset of COVID-19 and so forth. So I think the messaging I think should be cleared to the folks that it's safe, it's reliable, it's dependable, and we need to make sure that we don't add confusion to our citizens by adding doubt, because I would like to see that first dose continue to increase and not just plateau. And I think that's important. Those are sitting on the fence that are now hesitant. And even those who have received, AZ and so forth, we need to give them the comfort level that NACI and the medical officer of health and the chief medical officer of health are not out there giving out false information and so forth. So I've received it, and I still have 10 fingers and 10 toes. Nothing's changed in that regards, but full confidence. And the messaging we're getting from our health professionals is uniform and consistent. Judy?
Thank you, Gary. And to Dr. Wajid, question, is the data telling us anything about people who are getting COVID after the vaccine, about the level of severity of the symptoms? So the people that are ending up in the hospital, are they the people that have had the vaccines, or are they people that typically have not had vaccines at this point? Do we know?
So great question through you, Mr. Chair, Judy. And Public Health Ontario has just released their analysis, and I was midway in that reading that document. But the highlights of that analysis is basically just telling that people who are getting sick and need hospitalization, these are the individuals generally who are not vaccinated. So even if people who are vaccinated and if they're showing up as positive, their severity of the disease is very low. And even to the point that I think at some point we'll have to look at that, and we'll have to see whether we should even classify them as disease or not with just the mild symptoms. Definitely all the data and the analysis which came out from the clinical trial and continue to show that any of these vaccines, like even when you're talking about the less effective vaccine, they're all very good in preventing the hospitalization and more severe complication associated with COVID. And even with one single dose, it helps. The overall effectiveness continues to be much better. And again, just to that point about how Canada did it, and instead of again questioning the strategy of how the vaccine was rolled out, our data basically just shows that we benefited the most by increasing the interval of these vaccine. Right now we are the leader in the vaccine rollout, and it didn't compromise on anything. There was no increase of cases just because people has received one dose of the vaccine. We have in fact seen much more benefit of giving out more first doses rather than ensuring that everyone has completed their second dose without compromising on the safety and the effectiveness of this vaccine.
Thank you. So I think that, again, I'm glad to hear you say that. And I think it's important messaging to get out to people who may be wondering still about getting the vaccine, because it's one thing not to get it, but really the major goal, I think, is if you get it, it's mild and it just becomes a regular illness like anything else and not a pandemic. Secondly, I'm just wondering, because I hear people asking about, do we have a sense of when we're going to get messaging on what the expected behavior from the population is after the second vaccine? Are people still going to be expecting to wear masks? Is there any kind of sense? I mean, I know this is where, driving the car as we build it. But is there a sense coming down on what some of that messaging is going to be and when people will start hearing as we get 1 in 5 people with their second vaccine down here?
Yeah, another great question. I think we will definitely need to see that. The issue is you'll have to look at the province in totality and then country as in totality of where the pandemic is. With the travel and with everything, there's always this risk that someone who's unvaccinated, someone who can bring the virus into this. So there is still ongoing transmission in some parts of the world, and not far from here, even in the city of Detroit. Last time I checked, maybe it has changed, but last time when I looked at their coverage rate, it was close to 30%. And look at so our vaccination rate is much higher. So even from when the borders open up, there would be, and again, I'm not saying that this is a definite risk, but clearly would increase our local risk. And when we are removing these restrictions with respect to masking and gathering and all of those things, it just creates much more opportunity for the virus to find a susceptible host and continue to go on infecting people. So it will come, but I think we'll have to look at the totality of the situation, how we are doing, how our neighbors are doing, and how we as wherever we are traveling, how the rest of the region is doing.
Okay, and Gary, if I might, just one final question, and not for I don't believe for Dr. Ahmed, but so I had colleagues when a number of us tried to register for the second vaccine on the WeVax site, and I think there might have been a problem. A number of us were told we weren't eligible when we were, and I don't know. I did mention when I registered and talked to them later that there might be people might not understand when you say enter your health card if you're supposed to put the letters and the numbers. And some people thought they were putting the letters too, and maybe that's why they were saying they weren't eligible when they did fit all the criteria. So I don't know if that's something that's been looked into, but I had at least 10 colleagues who had that problem. So just a heads up, and I'm hoping that that's something that's been resolved, or at least can be clarified on the site. When you say enter the health card, what does that mean exactly? Thanks.
Okay, if Teresa or you got any feedback on that?
Yep, we have had that feedback, and we did our best to try to outline that it's all numbers with no spaces, no initials, and that we have anything that has been brought to our attention, we try to address it as soon as we can.
Excellent, thank you.
All right, Gary.
Well, thanks very much, Chair, and good afternoon, everybody. Dr. Ahmed, thanks for the terrific update and presentation. Can we just get an update on the future vaccination rollout here moving forward? I know the Windsor Star building and the St. Clair College buildings, I believe, are to be closing soon. Can you just tell us the applicable dates and and where it's going to be moving forward? I believe it starts on June the 21st, the transition.
So I'll start, but maybe Teresa would like to jump into that conversation. So this is, again, these are all ongoing conversation. You're right about the Windsor Star building, that they are vacating that and moving to the Sears building starting June 21st, which would be next week. And then there are further plans to consolidate all of these sites into one site, given that there are more and more opportunity for people to receive the vaccine. I'll pass it on to Teresa to maybe elaborate more on the transition plan.
Thank you.
So the plan is actually kind of how we were initially anticipating, that as more vaccine became available in our area through different channels, that the need for mass vaccination sites would change a bit. So in our area, we're getting a lot of vaccine that is going to our pharmacies as well as to our primary care providers. So right now we have 79 participating pharmacies. So the access for the vaccine is readily available in our community. With the Sears opening, the transition from the WFCU to the Sears building will occur, and that will be toward the end of July. And after that, the two sites in the county that are now currently Libro in Amherstburg and Nature Fresh in Leamington, we're anticipating that by the third week of August, toward the end of August, that they would be they would close, and the municipalities would have those facilities back. We do think that, based on our current rollout and the other channels that I mentioned, that the Sears site would be able to very capably accommodate any first doses and complete all the second doses.
Well, that's good to hear, Teresa and Doctor. I appreciate that. Now, will it still be a appointment only type procedure, or will there be any chance for walk-ins?
At this time, we're doing appointments only, and the province has asked for, the consideration of walk-ins, but we have not. We continue to be by bookings only.
Thank you.
All right, any further questions or comments at this juncture to Dr. Ahmed? Okay, thank you very much for the update, Dr. Ahmed. All right, move on to approval of minutes of the regular board meeting, May 20th. If can I have a motion on those minutes, moved by Judy, supported by Gary. Any errors or omission on those minutes? Hearing none, all in favor? Opposed, if any, the minutes carried. Any business arising from the minutes?
Sorry, Gary.
Yep.
Can I just ask if it was possible just to make a motion as to Dr. Ahmed's report, or is it too late?
Oh, thank you. I was ahead of myself.
Yeah, basically motion to receive, but I also wanted to make a motion to support the medical officer of health's position in advocating with the province for us to move quicker to stage 2 or phase 2 or whatever it's called, but that we just support the position of the medical officer.
Well, why don't we do it in two parts? So let's receive the report, and then you can move your resolution after. So move to receive. That'd be Reno and Joe. So all in favor? Opposed, if any, that's carried. I'll go back to you, Reno.
Yeah, so just make a motion to endorse or support the actions of the medical officer of health to advocate on behalf of Windsor-Essex to move into phase 2 at his discretion with the problem.
I missed the last piece. You broke up. At the discretion of medical.
Yeah, at the discretion of the medical officer of
Okay.
health to move into the next phase with the problem.
Okay, so that's moved by Reno. Do I support?
Support, Gary.
Thank you, Gary. Any further discussions or comments on the motion? All in favor? Opposed, if any, the motion carries. I'll go back to the minutes if there was any business arising from them. I see none. Move on to the consent agenda. We do have 5 items there. If I could have a motion to receive the consent agenda. Judy and Gary, all in favor? Opposed, that's carried. I will ask though, if there's anything that administration want to highlight or any questions from the board. Okay. There's 2 resolutions. One is the consumption and treatment services site identification and consultation. And I'm going to ask Teresa to speak on that resolution.
So this has been brought to the board before about our work on the consumption and services treatment site. And you may recall that about 2 years ago now, we did a consultation about the need for a safe injection site in Windsor and Essex County. So we continue to move forward, and this resolution is before you because as the situation in our community continues to not show any improvement and in fact show increased deaths and overdoses in our area, that we are now completing the final step in the application for a consumption and treatment services application for both Health Canada and the Ministry of Health for Windsor. That includes the identification of potential sites and then again a broad community consultation. So this resolution is to complete this process and do identify that 2 sites have been brought forward through our CTS advisory committee and through a lot of background work, and the sites are there in the resolution, and we would like to move forward with the consultation. And so the actual resolution is that we include the site location and the consultation, and that the Board of Health would support our health unit to finalize the site selection based on the outcome of the community consultation, and recognizing that next steps would include seeking City of Windsor Council approval for the proposed site and entering into an agreement with the landlord for the submission of this application.
All right, thank you, Teresa. Any questions on the resolution? No question, then a motion on the resolution. Reno moves and Fabio support. On the motion, all in favor? Opposed, if any, that motion carries. Okay, next one is our CEO, the transition, and Teresa.
So we looked at the practice of the board previously, and a resolution or motion from the board to approve the appointment of Nicole Dupuy as the incoming Chief Executive Officer effective July 1st, and her ability to bind the organization. So a resolution is before you for that purpose.
All right, moved by Judy. Do I support? Gary, questions or comments? All in favor? Yeah, go ahead, Reno.
Sorry, just wanted to quickly speak. I know this will be the last meeting Teresa will be sitting in with us, so I figured this would be the opportunity to really thank her. I know we've said it before. I don't think we can say it enough, but I think it really needs to be said at your last meeting, just how much we appreciate the time and the service, how much you'll be missed. I think the last year and a half really showed how strong your leadership was. So I wanted to thank you. Nicole has big shoes to fill, but we know that she will do a great job. But I wanted to just take a minute to thank you again for all the work, not just over the last year and a half, over your entire career, but really say thank you from both the residents and from other elected officials throughout the region.
Thank you.
So thanks, Reno. Yeah, I was saving that for just for the committee of the whole, but thanks for bringing it up. But certainly we're not going to be done. I'll be asking board members to bring in as well, and certainly want to echo your comments. Okay, on the motion, it was duly moved. Wait, did I move it or have it moved?
Yeah, it was moved and seconded, just didn't vote.
Okay, now I'll call the question. All in favor? Opposed, if any, that's carried. Thank you. All right, new business. No new business at this stage. Correspondence, if I could have a motion to receive 9.1 and also 9.2. Reno, Gary, on the communication, all in favor? Opposed, if any, that's carried. And okay, before we go into committee of the whole, I think this would be an appropriate time for the board as well, just to address. Yes, it's Teresa, this is your last board meeting. I'm not sure if there may be another JBEC meeting in between, but certainly your very last board meeting. It seems that not that long ago you were just appointed the CEO. It feels like it was just yesterday. Maybe to you in the last 18 months, it's probably felt like 20 years. But on behalf of all of us, and certainly your staff and most importantly, our citizens throughout Windsor and Essex, we certainly owe you a great debt for your leadership, your professionalism, and in particular, it's really shone through like a bright light in the last 18 months, especially under the pandemic and the tremendous pressure that the health unit has been put really under the microscope. But one thing for sure, it showed how important public health is. It's not, as we alluded before, the second or third cousin of the global healthcare system. It's the tip of the spear. This is where the rubber hits the road, and what we've been able to accomplish. The health unit in particular in working towards the end goal of this pandemic in our community and where we are compared to other regions. It wasn't without huge challenges, and in particular as host to the largest concentration of temporary farm workers anywhere in the country, in dealing with a lot of those issues, a border community. It's been quite a journey, and certainly through your leadership, you've guided us through it very well. And we're finally seeing the light at the end of the tunnel. And so on behalf of all of us, we want to wish you all the best in whatever comes from July 1st. Most importantly, get some rest, enjoy your family. And I know your family has sacrificed a lot. And I certainly want to take this opportunity to thank your husband and for giving you so much of you over the last 18 months in particular. And so we wish you all the best, healthy, in retirement, but you're far too young. I know you're going to be busy in other things, but certainly when COVID is really over and we can gather again, there'll be an opportunity to really, I think, give you the send off that you really deserve. You know, virtual is one thing, words are one thing, but certainly we're going to have an opportunity to give you the proper send off that you certainly deserved moving forward. So with that, God bless you. Thank you for your leadership but most importantly, Teresa, your friendship. I think that's something that I want to take away from our relationship as board chair and certainly the CEO is the friendship that we built over the course of the years. And I certainly will treasure that. So I'll open it up to board members. I know, Reno, you spoke, so I'll give you all an opportunity. Gary?
Well, thanks very much, Chair, and it's certainly as a latecomer to the Health Unit Committee, when Councillor Holt had to step down, I wasn't quite sure what I was walking into, but certainly with the help of Teresa and Leanne and the chair, it's certainly been a great committee to sit on, a very pertinent and important committee. And Teresa, you've made it easy for me to do that. So. You know, I don't know you very well, but you're the consummate professional, and thanks very much for your years of service in our community, and wish you the best in your retirement. Take care.
Joe?
Thank you, Gary. Teresa, wishing you all the best. I know the last few years have been very challenging in more ways than one, but again, it's so nice to have you know, a strong administrative team along with you and Dr. Waji, and you can tell succession planning in this organization is strong. And right now, as you're leaving, you know that this place will still be in good shape based on your leadership and the succession planning and mentoring that you've done. And so that's going to go a long way. So again, till our paths cross again, stay safe, and we'll miss you for sure. Thank you.
Judy?
Well, I do want to echo everything that the other people have said. I'll try not to, but I do know that a strong team comes from a strong leader. And that certainly has been evident through this pandemic and my time on this board of directors. I think there's a couple evident things. We're going through a pandemic, and yet the health unit is still looking at a safe injection site, major other important things for the community, and so many balls in the air that people I just don't think understand, again, how important and how progressive this health unit is. Looking at the consent agenda, I mean, the number of staff hired over the last year. I don't know if Dan sleeps or if he just is interviewing all night long. I mean, to just get that many people up and into an organization is incredible. So again, all that comes from a great team, which comes from a great leader. And I'm probably going to say this wrong, but isn't Teresa the first nurse to hold this position in the country? I thought I read something like that, which she wouldn't admit anyway. So
In Windsor-Essex, it is, I think.
for sure. So yeah, you've been a great leader, and enjoy working with you, and well deserved for your retirement. And we hope to see you in other ventures.
Fabio? You're muted, but there was a lot of interference, Fob. Have you got a headset? Okay, you can put it on the meeting chat. Anyone else? I think someone had to leave because of IRCA. Okay, then we'll move on, and we need to move on to committee of the whole. So if I could have a motion to move into committee. Judy, Gary, all in favor? Opposed, that's carried.